Hello, America. I'm Robert Reiss, and welcome to the CEO Show. We're here today with Marc Miller. How are you, Marc?
Doing well. Thank you, Robert.
And Marc is the CEO of Universal Health Services. Now, this is an organization really unlike any other organization that I know of. I think you've got 330 behavioral hospitals, 28 acute hospitals, almost 90,000 employees. Just talk about the unique UHS model, which you really pioneered as a consolidator.
I think that we're unique in a few ways. We were established in 1979, so we're in our 43rd year. What makes us different than most others in our sector is that for a healthcare company, we concentrate on two large aspects of the business: acute care hospitals as well as behavioral health hospitals. And that's a little bit different. Most of the companies in the sector would concentrate only on one. But we've done this almost from our inception and have continued to grow in both areas, both segments, to the point now where we're the largest behavioral health company in the US and the UK. And in total, you gave the numbers, we have almost 400 facilities at this point, but we have very large business segments on both sides, almost equal in revenue, which makes us different from most others in this sector.
Let's talk about you have values that are deeply driven throughout the spine of the organization and about 89,000 employees. How do you make sure that those come to life?
I think every business has its own culture. And again, I guess being in business for 43 years, we have a long track record. We've always had the ability to focus on long-term performance as opposed to making decisions for the short term. It's a very important aspect of what we try to do, and we try to communicate to our folks that we'll always do the right thing for the right reason and with a long-term perspective. And as a public company, that's often difficult to do. And we've been fortunate that we've had a very good track record for a long time. So and because we've performed well, we've been able to do some things that, while in the short term might make it a little bit more difficult, knowing that they were the right things for the long term, we've been able to get away with that and have had a positive effect because of that. And our employees embrace that because they know that we're doing things for the right reasons all the time, and they get on board with that. And I think that makes us a very healthy organization and has contributed to our success over so many years.
Let's talk about leadership. You've been president for over a decade, and you know this business intimately. And as mentioned, it's a unique business model. What do you see as your primary responsibilities as a leader? And then how would you define your leadership philosophy?
Primary responsibility really have to do along the lines with setting strategy, setting vision, and then making sure that I'm able to lead our folks, and it's not just me, obviously, our whole senior team, in putting in place whatever it is we need to achieve those goals. I think that it's very important, especially at a large organization like this. It can become more difficult to communicate that message and ensure that all of your employees know that you're in the trenches with them in a way. And so what we try to do, and we've been doing more of this the last few years, is to communicate in different ways. In the past, much like other organizations, we would rely on pamphlets and brochures and things we would put together to communicate marketing message and send those around, and we would visit certainly as much as we could our hospitals. But now with the advent of technology and social media, we try to do so much more online so that there are more touches with not just our staff, but also our patients, our physicians, so they see us communicate to them even more so than we were in the past, more frequently, in a way that I think they can relate to much better. Recently, and we're not always right on the cutting edge, recently we've got into more use of video on our own platforms. And again, I think that we're just improving the way we communicate. And I think that shows all of our folks who are our caregivers at the facility level that we're in this with them, and we're setting out a vision that they can buy into and agree with, and hopefully that'll help them, continue to make the decision to work with our company for the long term.
When we talk about leadership, talk about some leaders who you respect and admire, who you've learned from.
There are so many. I often read about various companies. I've been a student of Apple and Walmart for many years for different reasons. I always thought it was interesting. Walmart, because of their growth, every quarter, every year, they have to reinvent themselves to figure out how they're going to grow, because they're almost in every nook and cranny of the globe at this point. So it's interesting to read and see how they run their business, and that goes over many leaders. I think that with Apple, it's always been fascinating to me how a company like Apple was able to stick to certain values, core values, and really gave up early on the ability to grow because they wanted to perfect whatever it was they were working on. And so even though they only had, I think, about 10% of the market, Steve Jobs for many years was okay with giving up market share. He didn't really consider himself competitive to Microsoft per se, because he thought their products were inferior to what he was trying to create. And I think there are learning lessons there. We talk a lot about quality, and we also talk about, doing things the UHS way. We've never been obsessed with growth for growth's sake. For us, no matter how big we are or how small we are, we want to make sure we're focused on high quality at all of our facilities. And that's the most important thing. So whether we have 300 hospitals, 700 hospitals, or 10 billion or 50 billion, our focus is always going to be on patients and on quality. And you try to learn from other businesses to almost maybe reinforce kind of the values and what you're doing. And I think we've learned from many different people. I've certainly learned from my father, who was the founder of this company, a lot of what he set out, his goals, and we just try to live up to that and do things the right way.
When you talk about leadership, when you're interviewing candidates for leadership positions, what do you look for and how do you help them on their development path?
So there are many things that I look for when hiring folks. I think certain jobs require specific areas of expertise and things I would look for. But generally, for all leaders, you want honest, ethical people. I think also culture fit is a big thing. There are many wonderful people, many bright individuals who have had success elsewhere, but you're always trying to find people that will fit well in your culture. And then lastly, something I've always focused on is self-awareness. With every candidate that I interview, it's one of the things, if I don't talk to them about it overtly, it's certainly something that I'm trying to glean through the interview, through the conversation or conversations, to just be sure nobody's perfect. So we're not looking for the perfect candidate. What we are looking for are people that understand what they need to be working on. And a lot of those things, I have my own lifelong journey with different facets of my personality that I'm trying to improve. But if you're not aware of them, it's impossible to improve upon them. So self-awareness is a big one for me.
So you are the largest behavioral health provider in the US, in England, or UK as well. Talk about what the challenges are in behavioral health right now and how you can make a difference in the lives of your patients.
There are many challenges in the behavioral health sector right now, some of which we've had for a long time, some that have been exacerbated through the COVID pandemic. I think right now we're seeing an increase in need for behavioral health services all across the board, and that's only increased through COVID. So for the last 3 years or so, we've seen people trying to access services in different ways, but we also have a reality of looking for staff that you sometimes can't find, trying to navigate through just different barriers that have been put up because of the pandemic. Now, luckily, we're on the tail end of this. Things are opening back up. We still find ourselves searching for staff to be able to accommodate the needs of patients, but we're doing a better job recently, last 6 months, than we were prior to that. But there are many challenges, and we run so many different types of programs that it seems like when one settles a bit, then something else pops up. So we're just always trying to meet those needs as quickly as we can. But because of our size and our scope, we're able to meet those challenges for patients in a great deal of cases quickly. And those that we can't, we continue to work on. So we're proud of the work that we've been doing, but recognize that the challenges continue to be there.
What is it that CEOs need to know about behavioral health? You hear about it everywhere. It's integrated into every component of our society, from the economy to the well-being of people. I've heard that 1 out of 4 people actually have some type of behavioral health issue. So from a CEO standpoint, and that's who we're speaking to now, they have a lot of leverage. What would you like to tell CEOs about behavioral health and any advice to them?
I think the biggest thing probably revolves around stigma. Stigma in the industry, in the country, has always been a big issue, where people shied away from sharing troubles that they had in behavioral health for obvious reasons. Folks are worried about being shunned and getting negative reactions. So speaking to a CEO audience, I think what I would most want to communicate is that you want to be there to help your employees deal with issues as quickly as you can, because oftentimes, and the good news is the stigmas are starting to be relaxed and kind of, they're not as big as they were a few years ago. Oftentimes, if you can deal with issues on the front end or when they first surface, we can help prevent them from getting worse. And so as a CEO running an organization with many employees, I would think that all CEOs would want to try to help their employees in any way that they can. And that's a big part. Getting folks help early on can really make a huge difference.
Is that the single greatest leadership challenge you see in your industry today?
I think that there's many challenges. I think that patients' access to care has always been an issue. I do think that with the different ways that we're providing patient care these days, it's actually being helped. And so folks' access at this point is much better than it was 5 or 10 years ago. So for example, a lot of people think of psychiatric care as only inpatient care, but we do so much in an outpatient setting. We have intensive outpatient programs. We do partial hospitalization programs where there's some component in a hospital, but there's a lot of outpatient follow-up. And now with telepsych, with telemetry, being able to do things in a tele world have only increased the availability of services for patients. And that's a terrific thing. So the offerings now are so much more significant. So there's really no excuse to not be able to get help for whether it's a family member, a staff member, or anybody who needs it.
Okay, let's talk about reputation. And, as you and our listeners know, I've had enormous admiration for your father, Alan. As I think next to Warren Buffett, he was the #2 most tenured CEO in the Fortune 500. And he focused deeply on reputation. You've grown up with this, and you've been a leader at the organization for over a decade. What is your take on reputation, and how do you tie that in towards all of your organization and a CEO's role?
I think reputation is important in any walk of life, but it can't be any more important than an organization who's providing patient care. It's the core to everything that we do. People are choosing one of our facilities, one of our nurses, one of our doctors in a situation where they're most vulnerable. So our reputation is just so important. One thing I've heard across my life, and many of us have heard this as well, but it's certainly a core value here that, it takes a lifetime to build a reputation, but it can take a minute to ruin a reputation. And so we really think about everything that we do on a daily, weekly basis to make sure that we're re-emphasizing the importance, not just each of us, but to everybody that works here, the 89,000 people. Everybody knows and they hear from us how important reputation is. I talked already about doing things for the long term. It's doing the right things all the time, and you can't deviate from that. So reputation is the most important thing to us here, as I know it is for many people. But again, because of the type of business we're in, I think it's critically important.
Final question, the future of UHS.
I mean, the future is bright. I think that the healthcare business as a whole, it's always been a tough business. It's gotten tougher the last few years. We have some economy challenges now throughout the country, and that's affecting everybody, all businesses. But we have a mission to serve patients well. And whether we have a booming economy, a struggling economy, we're in a pandemic or we're not in a pandemic, people have to get healthcare services. So there's a great responsibility that's inherent in what we do, and we take that responsibility seriously. And as we talk about all the time, our future is incredibly bright. We are excited about a lot of the things that we're working on and planning for the future, but the core of it is taking care of patients in both of our business segments and beyond that. So we look to grow in different areas. It won't just be in our traditional acute and behavioral services. We're doing a lot on the tech side, and we're trying to get into some different business lines as well. We mentioned that we've expanded over the last 10 years in the UK, and so further expansion into other markets, certainly on the horizon. So we have a very bright future that we're very excited about.
And there you have it. We've been speaking with Marc Miller. A pleasure having you on the CEO Show.
Thank you very much.
And everyone, think about three things. Number one, when you think about behavioral health, think about the stigma, and that is the core we have to focus on. Secondly, when you think about your role, whatever leadership or capacity you're in any role, think about self-awareness. And finally, at the core of everything, as Marc pointed out, the most important thing is reputation. See you next week.